Tongue thrust for adult patients. What does it look like? Well, a lot of us will swallow forward to the side, or we even will swallow down with our tongue through our bottom teeth when we have a forward or anterior swallow pattern. Well, how do we correct it? Well, we have what's called swallowing therapy or oral phase dysphagia therapy. That is what we do at MarvelMyo Speech. We help people be able to reverse the swallow so that you're not pushing on your jaw, especially your lower jaw, and causing wackadoodle things to happen with your TM joints. And we also help you to reverse that pattern so you can get your food down easier. We tend to see GI improvement with this. Now, how do we do it? Well, there's a couple different ways. We have to look at how you're breathing first. If you're not breathing great, maybe you've got big tonsils in your airway. They may be pushing on the back of your tongue and making your tongue come forward. Some other things that we might see is poor muscle strength at the back of your tongue and endurance at the back of your tongue. We tend to see that causing issues because if you can't retract your tongue because the back of your tongue is weak, then we're going to come forward. If we can't breathe back here as well, maybe we have trouble breathing back here because of an airway problem, or we have something going on in our nasal cavity, we may tend to thrust our tongue forward to try to open up that airway back there. Some other reasons might be a tongue tie. Now, that is the social media term that people are using these days, is tongue tie. The technical term is sublingual ankylosing. Very fancy term. But what we can do in an evaluation with you is we can look to see if you have, in fact, sublingual ankylosing or tongue tie. Now, everybody has a string under their tongue. Everybody has a string. It's normal to have a string. You actually have 7 strings in your mouth. You have one here, one here, one here, one here, one here, one here, and one under your tongue. But if your string is a little too tight under your tongue and it causes functional problems for you to swallow, we can take a look and see if a dentist can help us or another provider to try to help you address that if need be. That's another great thing that we can do is we can refer you and kind of quarterback you to the person you might need to see who might be able to help you with that release of that really tight what's called frenum under your tongue. Everybody has those 7 frenums. We may just need it to be released so your tongue can easily swallow more effectively for you. So if you're somebody who has trouble with pill swallowing, or you have a picky eater in your family, or you have trouble with getting things down, or when you do swallow pills, you cock back your head, or anything like that, or if you have trouble with doing what's called a rotary chew pattern, which means your tongue goes to the side and moves your food to the side while you're chewing. As an adult or a kid, we really should be doing a rotary chew. If you have trouble moving your tongue to the side like that, or you feel like your jaw just goes way too far over here to help your tongue move that food, it might be a reason for you to call us so we can help you get that pattern down more easily. If we have a tongue tie and it's really tight under our tongue, when we go to chew like that for a rotary chew, we're going to overuse our jaw and it can really lead to fatigue on the sides of our mouth. Some people also tend to stay in a poor chewing and swallowing pattern. They tend to stay in what's called a munch pattern. What we tend to see is much like babies do, patients will often, instead of moving their tongue to the side with the food and chewing it on the surface of their tooth and the cheek helping the food stay on there, they tend to move the food, but then their tongue goes back to the middle and starts going forward as they're chewing. So this is something we can help you with if you are having this issue. This is not something that can be done on YouTube. This is something that takes very strategic steps and planning to be able to teach you how to do this with not only your saliva, how to swallow correctly, your liquids, your purees, your solid foods, and even mixed textures. So we would love to help you. Our evaluations are an hour long and we look at many of these things and can help you swallow correctly and do it with all of your foods and all of your liquids, because You swallow thousands of times a day. So if we don't get it right, we're really going to overuse our muscles and our facial muscles and our joints. We don't want to do that. That can lead to fatigue and pain and popping and clicking. So if you're an adult patient or you also know a kid ages 5 plus, this is what we can help you on, is proper chew, proper swallow, and getting that tongue thrust out of the picture.